Hello, my name is Celeste Aurora, and this is my presentation on postpartum depression. Postpartum refers to the time after childbirth. During this time, mothers might get what is called the baby blues, where they might feel sad and empty for a few days after delivery. For many women, those blues disappear after 3 to 5 days. But for some women, those blues do not go away for 2 weeks or even more. This may be because they have postpartum depression. Postpartum depression is a serious mental illness that involves the brain and affects your behavior and physical health. Mothers might not feel a bond with their baby, feel like they are not the mother, or not even love the baby, and these feelings can go from mild to severe, but these emotions can also affect the well-being of the child. The body and mind goes through many changes during and after pregnancy. Researchers say to reach out if you need help, if you feel empty, emotionless, or sad for most of the time after 2 weeks after delivery. Another way one may know they have postpartum depression is if they feel like they don't love or care for their baby. However, it is good to know that there is treatment and help out there that works and will help mothers and their babies be better and healthier for the future. But postpartum depression can also be a threat towards the child by the mother when they forget to do important things for the baby, such as not placing the infants to sleep in the face-up position as recommended, not immunizing infants, or not bringing to normal checkups, and not using car seats correctly. Some way mothers may know if they have postpartum depression is if they have these symptoms following delivery after 2 weeks. Feeling restless or moody, feeling sad, hopeless, or overwhelmed, crying a lot, having thoughts of hurting the baby, having thoughts of hurting themselves, not having any interest in the baby, not feeling connected to the baby, or feeling as if your baby is someone else's baby, having no energy or motivation, eating too little or too much, sleeping too little or too much, having trouble focusing or making decisions, having memory problems, feeling worthless, guilty, or like a bad mother, losing interest or pleasure in activities you used to enjoy, withdrawing from friends and family, having headaches, aches, and pains, or stomach problems that just don't go away. Things that cause postpartum depression are hormonal changes that occur during pregnancy and after delivery. During pregnancy, the levels of hormones, estrogen and progesterone, are at the highest they will ever be. But the first 24 hours after childbirth, hormone levels quickly drop back to normal. So researchers believe this may lead to depression, which is similar to the hormone changes before women's periods, which brings women extreme swings in hormone levels. The thyroid hormones drop after delivery, and low thyroid hormones levels can cause depression. A simple blood test to determine the level of thyroid hormones can be taken to then prescribe thyroid medicine to bring up the levels and make women feel better.
My name is Jean Laktash. My daughter Kateri is going to be 5 next month. So I'd like to share my story a little bit with postpartum depression and anxiety.
My name is Esperanza Williams. I have twins that are 18 months old, and I just wanted to share my experience with postpartum depression. Suddenly I'm at home by myself with 2 babies, never having even changed a diaper, and healing from a major surgery myself.
I just started getting more and more anxious and just started feeling just more kind of out of body.
What told me that it was a little more serious than baby blues is that the feelings persisted even after I went back to work. And to get completely real and raw with you, there were times when I was driving home from work and I'd drive past a river when I come home and very seriously had thoughts of just driving my car into a river.
I was in with my OBGYN just for my regular annual exam. She just kind of asked me if I was okay. When she asked that, I said, not really.
It's an anger about how sad you feel when you know you should feel so happy. You have everybody in your life telling you, these moments won't last forever, soak it up while they're small, sleep when the baby sleeps, and none of that's realistic.
I learned that postpartum isn't just being sad. And I wish that I had known that a little bit sooner, because it sort of compounded my guilt a little bit, and it made me feel inadequate that A, I didn't catch something, and B, that how dare I not enjoy motherhood and everything that came with it.
And I knew about researching car seats and breast pumps and how long they should nap, and should I puree my own baby food or should I buy the jars, and am I going to kill my kid if I buy the jars? But nobody told me that I might want to kill myself. It's important to know that this is completely normal. More than half of women who have children experience this, and it's just, there's such a stigma that nobody talks about it.
5 years later, I'm still struggling a little bit, but at least I know why, and that helped me a lot. I hope that I can be a good example to her, that she sees that I am my own person, that Mama is also Jean.
I finally found a therapist that I see weekly still, even though my twins are, coming up on 2. The one thing, even through all of this, is that I always remained strong of my love for them and how I didn't want to go anywhere for them. There's no shame in advocating for yourself. If you have a brand new baby, tell me that you would not go to the end of the earth to get that baby whatever help they need if they need it. You'll never be able to do that for your baby if you can't do it for yourself.
Just talk to somebody. Voice your concerns. Do not be silent. Silence was the thing that was the hardest for me.
Women who are more at risk of postpartum depression are those who have a personal history of depression or bipolar disorder, have a family history of depression or bipolar disorder, do not have support from family and friends, were depressed during pregnancy, had problems with a previous pregnancy or birth, have relationship or money problems, are younger than 20 years old, have alcoholism, use illegal drugs, or have some other problem with drugs, have a baby with special needs, have difficulty breastfeeding, or had an unplanned or unwanted pregnancy. Postpartum depression affects about 10 to 15% of adult mothers yearly, but mothers with depressive symptoms lasting more than 6 months, among 25 to 50% of those are affected. However, there is no clear number on how many deaths due to postpartum depression happen each year. But when linked with opioid use, there was 70% of deaths involved opioids during pregnancy or up to 4 days postpartum.
You're exhausted, you're unsure if breastfeeding is going right, why is the baby crying? I mean, there can be a wide range of emotions in the first couple weeks. 80% of women will experience this, and we kind of label that as kind of the baby blues. So that's normal. Expect that to happen, and there's a light at the end of the tunnel. However, for about 15% of women, it goes beyond that, and that is what we would label as postpartum depression. If they start experiencing symptoms 9 months down the road, they don't necessarily relate it back to the pregnancy. But really anything in the first 1 year we would label as postpartum depression. Classic symptoms of depression: feeling hopeless, crying too much. Sometimes it just shows up as irritability. Of course, if you're ever having feelings of wanting to hurt yourself or wanting to hurt others, we need people to seek out help immediately. The biggest thing that I want to instill to women is that they just need to be open about it. There's no need to feel shame, to blame themselves. They are not being bad moms. They shouldn't feel like failures. They just need to be open about it.
Around the world, postpartum depression affects 10 to 15% of women. However, in Pakistan, postpartum depression affects 28 to 63% of mothers. This big range is due to the underreporting due to accessibility, culture, awareness stigma, and self-shame. The country prevalence might be due to cross-cultural and diversified socioeconomic situations, making it difficult to obtain a standard prevalence rate for your country. During a comparison among Asian countries, it was reported that Pakistan's postpartum depression prevalence amounted to 63%, while Malaysia had a prevalence of only 3.5%. When postpartum depression rates between Asian and North American countries are it is evident that Asian women have higher rates of postpartum depression during and after pregnancy. Of the other Asian countries, Pakistan has one of the highest postpartum depression prevalence, second to Taiwan. Postpartum depression in Pakistani mothers is associated with harmful impacts on the children's mental health, as well as physical impacts on children, such as stunted growth, a higher risk of delayed language, and delayed motor growth development. Postpartum depression can be a burden later on the child's life, with less than optimal health status in later stages of their life, and can be a health and financial burden on the healthcare system. A decreased level of education among women has repeatedly been associated with increased risk of postpartum depression. This association particularly amplified in Pakistan as the literacy rate is severely low. The WHO reported the literacy rate to only be 54.2% overall and 45% for women alone. The majority of women with prolonged postpartum depression in Pakistan are illiterate. Only 10% of primary education and 2% have a graduate education. A substantially low literacy rate can also have secondary repercussions as education levels can influence accessibility and health-seeking behaviors, which may turn influence postpartum depression prevalence. Women with lower education and income are less likely to get and take prenatal vitamins and are not aware of the postpartum care they have access to. The diverse and rich presence of culture in Pakistan make it a valuable target for developing future intervention. The presence of community support and comfort can be utilized to present a program which new mothers are comfortable with and more likely to engage with. A basic understanding of Pakistani women's cultural beliefs, values, and practices will enable a holistic and receptive package which restores functionality by utilizing coping mechanisms within a community-based culture, available services, cultural and political security, as well as available human resources. Unlike mothers in Pakistan, there are more resources and ways mothers can seek help in the United States. However, even though the education levels are higher and more available to women in the United States, where women learn more about postpartum and the effects of hormone levels that has on women, it's still a big problem. The populations of women who are more likely to experience postpartum depression are the ethnic minority, since it has shown that non-Hispanic white women are less likely to have it than any other ethnic groups. There are more mothers with lower educational attainment and then receiving Medicaid benefits for their delivery. That means lower education and lower income correlates with higher postpartum depression. Many celebrities and women are coming out with their experience with postpartum depression and how it has affected them, and giving women a way to show that postpartum depression is serious, but other women are not alone in their battle. It's a great use of platforms, and celebrities like Chrissy Teigen have come out and shared a lot of their personal life and dealing with postpartum depression and her child life with pregnancy and miscarriages. But it's a great use of her platform to share her story, and platforms like YouTube and news sites sharing other women's stories of postpartum depression to give a view of others who may not have a great understanding on the subject.
Our girl, Chrissy Teigen, who has two adorable kids with her husband, John Legend, has never been afraid to speak her mind. And while she likes to joke around on Twitter, she recently took on a more serious topic on a recent episode of the Today Show. On the show, Chrissy spoke very candidly about her experience dealing with postpartum depression and the moment she realized she was experiencing more than just the baby blues. Chrissy said, quote, "I thought it was the baby blues until people around me started telling me they saw distinct changes in my personality that was really helpful to me. I had really changed." Chrissy is also using her Instagram to encourage other moms to bring awareness to postpartum depression by posting a picture that captures what it felt like having their new baby and describing what they wish they knew when they were going through it. Wow, I think this is so great that she's using her platform for this. So Tam, I know this is an issue that we've touched on before and that you've touched on. Can you relate to what Chrissy is saying here?
I can relate to Chrissy on all levels. I think one of the things that I haven't really talked about during my time with postpartum depression is when I was doing this show, you know, it's called The Real. And when I was experiencing postpartum depression, I wasn't ready to accept it just yet. So I felt like I was here, but I didn't feel like I was being my authentic self because, one, I was afraid. Two, you guys know me to be a very, like, type A person. I always like to be in control of my emotions and my feelings, and I like to be described as a strong person. And in that moment, I didn't feel any of that. I felt weak, you know? And I think that's one of the hardest things, is to accept that, wait a minute, okay, yes, I might be experiencing postpartum depression, but this does not define me.
Yes.
It's normal, and it's okay.
Yeah.
It's totally fine, and it does not mean you are weak at all. But in that moment,
it's hard to remind yourself that.
Well, yeah, because postpartum depression there's a spectrum.
Yeah.
So I didn't really know what the hell was going on. I just knew that I wasn't fully 100% myself. Because usually they say you want to, you know, kill yourself or kill your baby sometimes. That's on the deeper, you know, extreme side of postpartum. But I wasn't having those feelings. But I also wasn't just having baby blues. I would find myself like literally in a ball sometimes, just crying. And then my husband, it was his face. He looked up at me and he just felt helpless. And then I think it was you, because I would come to work and she would ask me, how are you doing? And literally I would just start crying. And she's like, Tamara, can I be honest with you? Do you remember having this conversation?
Yeah, I do.
And you were like, yep, in your own room. You're like, Tamara, I think maybe you should possibly, you know, look into postpartum depression. I think, girl, I think you might have it.
And that's okay. And I think even as a friend, if you come at someone with love, can you be honest with me? Did you feel offended in that moment?
Not at all. I felt loved. Definitely in that moment.
It depends.
I felt seen.
And if you say it in a way that's genuinely like, I don't want you to feel... I actually felt like you thought you were crazy.
I did.
And to be able to tell you, I don't think what you're experiencing is crazy. I think this is real. The same way people tell you, go to the doctor if you have a throat infection, if you have bronchitis.
I don't know why
Our
I'm getting emotional.
minds are the same way. It's a part of our body. If a chemical isn't functioning correctly, and that's real. Hormones are real. If we feel them during PMS, why wouldn't you feel it after giving birth to a whole other person?
Yeah, but I think...
No, I love
but
it.
I think what happened...
You remember being there.
Yeah.
Yeah. I remember it too. It was... We come together, like, people don't get how tight-knit we are. When you wake up at 4 o'clock in the morning...
You have to be
stuck together. You
gotta...
You create a bond.
Yeah.
And I think the bond that we've experienced through childbirth, through divorce, through different things that we've gone through, it's made us so tight.
Closer.
And I think I did see you. We saw you in that moment. And I still say to this day, I don't know how you did it, but man, you should be so proud of yourself on so many levels. As an incredible mom, which you see her be every day because you're there with her all the time. And just being a badass woman.
Thank you.
Welcoming a new baby into the world can be the happiest day of a mom's life, but that time can be extremely difficult for women battling with postpartum depression.
Postpartum depression is kind of an exacerbation of the blues and the stress.
OBGYN Dr. Rachel White says postpartum depression is a common diagnosis that can last a few weeks after delivery.
There's a ton of emotional and hormonal changes that happened, and not to mention the physical changes that your body's going through.
Symptoms can be inability to concentrate, trouble sleeping, and overly emotional. Doctors say if a mom is experiencing these symptoms longer than 2 weeks, she could be dealing with depression.
Less than 20% of women actually will only report to their doctor that they're feeling depressed. So it's important to really dig into every patient and assess their symptoms. What we do and what ACOG recommends is to screen every single woman that walks through your door once in pregnancy and then again postpartum with a standardized questionnaire.
Risk factors for postpartum depression can be having babies close together, having trouble breastfeeding, or having an unplanned pregnancy.
A lot of moms feel really bad about being depressed. You know, I'm a new mom, I should be happy, I should love this baby. But it's really important for women to understand this is a medical diagnosis. This is not something that is their weakness or that they're just not a tough enough mom. This is a real thing.
Doctors encourage moms to participate in social groups, surround themselves with supportive family and friends, and make time for themselves every day. Counseling and medications can also be helpful. Anything to help moms cope and feel more connected to their baby. For Lee Health, I'm Lindsay Morton.
The best things mothers should understand is that there is treatment, medicine, and help out there to treat postpartum depression. There is psychotherapy, which is where women with postpartum depression can just talk to someone and receive counseling. 2 examples of psychotherapy is cognitive behavioral therapy and interpersonal therapy. Cognitive behavioral therapy is a type of psychotherapy that can help people with depression and anxiety. It teaches mothers different ways of thinking, behaving, and reacting to situations. Through this therapy, mothers can learn to change unhelpful patterns of thinking and behaving and improve their negative and depressive feeling and emotions. Second is interpersonal therapy, which has been used to treat depression, including those with postpartum depression. The goal of this therapy is to help mothers improve their communication skills in their relationships, to develop realistic expectations that allow them to deal with crises or other issues that can be a factor of their depression. Here are my resources for my presentation, and thank you for listening.